One. Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient / survivor. Been dealing with cancer since 2021 and doing very, very well. And I'd like to welcome everybody to the channel. Please subscribe, like, make a comment in the comment section. And we really appreciate you joining us today. And things out here in Texas are really, really great. We're so happy, with our grandchild that is here, and we're taking care of her a lot. And it's just been a true blessing to be here. And at this time, I am so excited and honored to introduce to you a really, really special guest. Her name is Joycelee Baumgartner. Joycelee, please introduce yourself and tell us who you are.
Sure. Hello, everybody. My name is Joycelee Baumgartner. I live out here in California, and I have the pleasure of meeting Mark. And we were able to speak about both of our cancer diagnoses. I'm currently still in treatment. I was diagnosed with stage 3 duct carcinoma, breast cancer, and I was diagnosed November 29th, 2022. There are just some days that it just sears into your mind, and that's one of those days.
Oh,
So
yes.
that was November 29th, 2022. I received my port December 14th, and I started my intravenous chemo December 15th. So that lasted from December all the way through June. After that, I was able to rest for about a month, and then I went and I got my surgery done. Soon after that, I went through 38 rounds of radiation, and that
Wow.
ended. That ended. That ended a few months ago, and then now I'm on oral chemotherapy. So I'll be on oral chemotherapy I started in January, and I will finish my cycle July of this year.
So how did the radiation affect you afterwards?
After going through 30 rounds of chemo, I thought, oh, gee, radiation should be a breeze, right? But actually, I went every single day for my 38 rounds.
Oh my
And
goodness.
towards the end, it really started to burn. So I saw a lot of burn marks on my left side of my upper body, and the fatigue was I would say just about as tiring as it was when I was taking the intravenous chemo. So,
Wow.
and during that time that I was going through intravenous chemo, um, I was admitted to the hospital 6 times because my white blood cells were just extremely low, especially the last part of my cycle of chemo. I had to take what they call the red devil. And so that not only killed the cancer cells, but it also killed the good cells in you as well. So your immune system fell, your white blood cells were just extremely low. So my oncologist took extreme precaution with me, and as soon as my white blood cell counts were low, I was immediately admitted into the hospital for an extended stay, about a week and a half each time.
Oh my goodness. So why don't you share with the audience a little bit about your background and your family? Because that is just I don't even know how you did it.
Sure. So I am a military brat, very proud of that. So I was raised in Japan, And I lived there from 6 years old up until I was 17. Then I went back here to the United States to pursue college. Got extremely homesick, begged my parents to allow me to come back to Japan. And so I did. And then when my father was due to retire, we went back to California, which is our permanent state of residence. And went to LMU and started working for the government as an electrical engineer. Uh,
And by the way, we're shocked because just before the interview, we found out we're both alumni of LMU, which is Loyola Marymount University in Westchester, California. So that's pretty
go
amazing. Go ahead.
and then after that, I got married, settled down, and I had 7 kids. I have 7 children. Their age range from my eldest is 30 and my youngest is 16. So yeah, it's been a journey for all of us, and I'm very grateful and proud of the support system that I have. Having cancer is has a lot to do with your mindset, your emotions, your spirituality as well too. So all that combined, having the support system that I had, um, really helped me get through probably one of the darkest times in my life.
I just can't even imagine how you were able to navigate all this at one time. It's just astonishing to me. So how did you do it?
Well, again, like the support system, it's so crucial when you're battling such a disease as cancer. Um, so I have half my children are in college or finished college. So we always have one child that's going to be the orchestrator of all the events, right? So my eldest daughter, she would organize times where they'll come visit me or like cook for me, clean. And so it, what they say about like it takes a village to raise a family. Well, it also takes a village to keep the village going. So um, yeah, without them, their support, I don't know where I would be. And also the support of my Zama, which is where I went to school in Japan, and my Yokosuka High School. So my Zama and Yohai family in my military family really stepped in, encouraging me, um, constantly texting me, checking up on me, sending me cards, sending me little mementos to try to keep my spirits up. So it really helped to have that support system in place while you're going through your journey.
Oh, absolutely. So let's talk about your mindset when you found out you got cancer, and then how did that affect your family? What would they say to you?
So my mother also suffered through cancer as well. So I was able to witness firsthand what the disease does to you. Um, when I received my diagnosis of having stage 3 breast cancer, um, I immediately knew which oncologist I wanted to watch after me. And that kind of like was a stepping stone of all the parts that I was going to have to go through. So being in the familiar setting because of my mom's experience, I was able to get into the oncologist group that I wanted to go into. I had I couldn't go to her oncologist because she was no longer taking new patients, but I did get a fellow oncologist in the same group that has been remarkable. Um, and I go to the same infusion team. So they remembered me from when I would take my mom to infusion, and I went to the same radiologist that she went to. So it was familiar. but at the same time different because you're going through it now rather than waiting in the waiting room and being their support system. So
That's I just can't believe I am just so amazed at you're I mean you look great and you have a family of seven and then you also have dogs and I mean to hold all of it together. I mean, it does take a team, absolutely. Everybody working together. So what kind of conversations would you have with your kids about your cancer?
I'm very fortunate enough to where my kids were very proactive in my treatment. So every time that I would have to go visit my oncologist, I would always have a kid with me. So they were able to hear the same information that I would be receiving at the same time. And if they had any questions, they're very vocal about not being shy at all, asking my oncologist, okay, so what's the next step? What does this mean? They wanted to gain as much knowledge to be able to understand what I was going through. I have a son who's now an RN, so he came a lot with me, and I have another son who is going to be a physician assistant. So he was very proactive in coming with me to my regular appointments as well too.
So you have your own personal medical team, sounds like.
I do.
That's phenomenal. That is really great. So were all your kids on the same page, in reference to, what mom was going through?
Yes, I think because I've been a single mom and they just assume that, oh, this is another hurdle that mom has to go through. She'll make it. Yeah, she'll be fine. So they were concerned, but they knew that I had a lot of strength in me. And they just kind of rallied around me and making sure that, you know, I'm okay mentally, emotionally, um, physically. They can see that I was getting weaker. Um, I think the most shock for them was after the second chemo treatment that I had, I absolutely lost all my hair already. So I had to shave my head. So my girls shaved my head, and my boys all left to go to the bathroom to cry because they didn't want to see um, me in that state. But
Wow.
I kept my chin up, and I to be to get to have them strong, you have to show that you're strong as well too. So they understood.
Wow, that is beautiful. Absolutely beautiful. I love hearing that. So basically your mentality was you have to show your kids that you're going to be strong and you're going to have the will to make it. Is that correct?
Yes, absolutely. I mean, just being a mother of seven and having to build that foundation for them, to to be tough. I mean, like life is not easy. So, and having seven, I had to juggle all of them, taking them to different sports, different activities. So I built a very strong foundation for them to do well scholastically as well too. So they knew what my priorities were. They knew how strong-willed you have to be, and they knew my struggles, and they just wanted to pay it forward and be there for me as well.
Man, that is fantastic. Absolutely fantastic. So you're going through these cancer treatments, your family's pitching in, and it's all like you're on the same team, which is rare, very rare. I mean, to have that kind of support system, because uh, I mean, my situation. there was, people here and there always saying, why are you doing this? And, you know, and I wanted to do it my way. And as it turned out, it turned out to be the right thing for me. But everybody's different. Everybody reacts differently. Everybody's cancer is different. Everybody's mindset is different. And so, to have that continuity that you have is just amazing, and it's a blessing, and I rarely hear this. Usually it's like, oh, this person here doesn't agree with me, and that's part of the uh journey of cancer is most of the time people are not on the same page. So for you to have that's an amazing, amazing thing. And that's one of the reasons why you're doing so well, I believe, is because you have that uh everybody, you know, going towards the same goal.
It also has to do with a lot of being able to have knowledge of what you're going through, and don't be afraid to ask questions, and and don't be afraid to go through the emotions that you're going to go through, because not every day you see me smiling here. It was a tough journey. It is still a tough journey,
Mhm.
um, that I'm still going through, and it's been almost 2 years, and you're thinking to yourself, when is it going to end? You start to think like, when am I ever going to be normal again? What is normal now? Because you've been so out of touch of what's your normal, what normal is.
Right. I mean, that was one of the things when I was going through the major portion of my cancer journey was I had to put aside who I was and accept who I am today. And
Exactly.
and, and every day I'd look in the mirror and I said, okay, I'm here right now and I'm going to do my very best with what I have now. Because prior to cancer, I was in great shape. I worked out 4 to 5 times a week, and I was really, really strong. And then all of a sudden, cancer comes, and I'm down to 123 pounds and just weak as a weak can be. And
Yeah.
so, having to accept yourself today as a cancer patient is a huge thing. And understanding that, I'm going to deal with today and look forward, to the next day and the next day. And pretty soon you start putting together good days. And that's, I think that's how I did it. And
Mhm.
I don't know, what are your thoughts as far as that goes?
I agree wholeheartedly, with everything that you had said. Another aspect of it is, it really humbles you. It really humbles you. It makes you reprioritize what's important in your life. And when they say don't sweat the small stuff, you just have to live day by day. Obviously, with my with my family situation, having 7 kids, I've always been the planner.
Mhm.
So if and especially having as many children as I have, you have to plan 5 steps ahead. And that I was the exact same way with the whole in the beginning part of my cancer, was like, I was an overthinker. Um, as I went through my daily struggles and appreciation of still being here, you just have to reprioritize and realize, you just got to calm down. You just have to like learn to let things go. And it is what it is. And just be grateful that you do have the support system that you have. Be grateful for every day that you're here. Just be grateful for all the blessings that comes, you know, with having cancer. It's like I pray every day, and I tell God, like, I thank him. I thank him for giving me this challenge and trial in my life because it's made me a better person. Um,
How has cancer made you a better person?
I've learned to have a lot more faith. When you had said earlier about like listening to yourself, listening to your gut, what's best for you. I did the same thing. But mine is more towards a spiritual um, growth. I've always been faithful to my church. I've always had faith. But this really catapult me into like really thinking about what's important in life, you know, and reprioritize everything.
Yeah, that's absolutely beautiful. I mean, you're it's music to my ears, basically. I mean, you're telling me things that I've gone through, and to hear it from you who's still in the throes of it is I just really, really admire you. I really do, and all the things that you deal with, and you've got a smile on your face. I mean, that's what it's all about. Because, for me, I wouldn't wish cancer on anyone, but for me, it's changed my life for the better. It really has. I mean, I wouldn't have been able to open my eyes and understand, the true beauty of the simple things, you know. Um, when I was in my room for we had an upstairs room. I was in my room for almost 3 months straight because I could barely walk. And so the very first day when I was able to go downstairs and open my front door and walk outside for the first time, it was absolutely amazing. I mean, things that I had just walked by thousands and thousands of times before, now I looked up and the sky was really blue and the leaves were really green. It was like, wow, this is this is amazing. And these are things that I just took for granted. And so that's uh, the beauty of what cancer could do to open your eyes to things that you may have overlooked before and took for granted. So and it sounds like you've experienced the same thing.
Yeah, what you said is so beautiful because it is so liberating to be able to humble yourself and really look internally and like I keep saying, reprioritizing your life and taking away what's not important to you that it was important before. So
Mhm.
it's like shedding an outer shell and you feel lighter, you feel more free, you just feel you just feel lighter in every way. So
Abs-
it's a really liberating feeling.
and so now you're able to talk to and understand better people going through, health crises and cancer and things like that. I had no clue what cancer was all about until I got it. And then like you talked about earlier, you educate yourself. And boy, if you get cancer, you better start educating yourself like today.
Mm.
And that's really, really critical for anybody who gets a cancer diagnosis. Start learning about your cancer and start studying it. And, because whatever we become, when we're growing up, going to school, whether we are an accountant, a doctor, a lawyer, whatever it is, we studied many years to become, that profession. Nobody studies cancer. And so all of a sudden you get diagnosed with cancer and you're expected to make life-changing, life-altering decisions with no knowledge about it. And that's a scary thing. That's a very scary thing, wouldn't you agree?
Absolutely, especially if you have a family
Yes.
and you're responsible for that family.
Hmm.
You you start to overthink about a lot of things, and um so going back to what I said, just reprioritizing and like being able to like analytically and emotionally, I'll take that all in. Um, it's like you said, education is key. Um, Empathy and sympathy is key as well too, because now, now that I'm still in the throes of treatment, but I did reach out to the National Cancer Society here locally, and I want to be involved in educating other people, like understanding what another person's going through. Just be an ear. Sometimes people don't have that person that they can just like vent to, because having cancer is an emotional roller coaster. You'll be fine one moment, and the next moment you just feel defeated. You don't know how to assess your feelings. You don't know how to navigate through all these mental, physical limitations that you have to go through. So I want to be I want to be that person that somebody else can feel comfortable knowing that I know what they're going through. Everybody's diagnosis, everybody's side effects are different, but the basic foundation is the same. We both had went through a disease or going through a disease. We both have, challenges in our lives, emotional, spiritually, mentally. Those are all key components of, trying to help another person who's experiencing the same thing that you're going through, go through their journey.
Right. And the amazing thing about the internet is it really has the ability to tie things together. I mean, I knew when I got cancer, I knew that that screen I was looking at, I knew the answers were out there. I just had to find them. And you know, I've been so blessed and so fortunate to meet amazing, amazing people all over the world. And kind of like I don't remember exactly how we connected, but we did connect on LinkedIn. And LinkedIn's been a very, very valuable resource of meeting people and there's a great cancer community, support community on LinkedIn that has just been amazing, absolutely amazing. And I mean, I'll be forever grateful to the people that I've met along this journey, um, such as yourself. Yeah, I mean, I've just thoroughly, thoroughly enjoyed our conversation here. So, what would you like to leave our audience with, uh, as far as pearls of wisdom or whatever it may be?
Pearls of wisdom. Just, I wouldn't say like try to accept it, but understand um, your diagnosis. Know that there are other people out there who understand what you're going through, and that you just reach out to, like, there's so many, like you said, there's so many different opportunities to connect with people, and just be steadfast in your own personal journey with this disease that I wish we can find a cure for it. I It's like I said, like what you said, I don't wish this on anybody, but um just reach out, get that support that you need. Um keep keep your faith, whoever you believe in or whatever you believe in, you know, you have to just be mentally, spiritually strong, because it is an uphill battle. It's not,
Absolutely. It
but the any
is. It
fighting your,
definitely is a battle.
yeah, it definitely is.
So I have one final question for you, and it's totally different than what we've been talking about. We live in our world today is very divisive and very negative, in a lot of places. How would you, Joycelee, help make this world a better place?
Just be kind, just accept who you are and how you transform during this journey, and use that wisdom that you received to never judge a book by its cover. You don't know what another person's going through in life. So always be kind, and be empathetic, be be a better person, be the person that cancer had recreated,
I,
to, like I said, like, having cancer is such a humbling experience. And just keep that with you, close to your heart. Just be kind. Um, yeah, that's all I can say.
I love
Just
it.
be a positive image. Just project positivity, because you don't need negativity in your life. So if you send out positive energies, people can feel that too.
Absolutely. Absolutely. Joycelee, thank you so much. It's been an honor to have this discussion with you, and I really appreciate you. Uh, and thanks to all of you out there for joining us here at To Be Your Own Hero. Uh, and I hope everybody has a very blessed week. Joycelee, be blessed yourself. Uh, and thank you so much for joining us. And we'll see you next week on To Be Your Own Hero. Thank you very much.